Hi there. It's April 22nd, 2020 in Atlanta, Georgia. And I'm Boyd and I just felt like I had to say something. I don't know if it's right or wrong, but I've been paying a lot of attention since this corona came through, not the beer, but the virus. And this COVID-19 has been hurting people. And one of the things that I feel it's not political at all. It's either science or not science. And we got to find a way to deal with it. Everybody's going to deal with it in a different way. But the important thing is we're all in this together. And that sounds kind of kumbaya-ish, but the reality is that if we stop it here in Georgia, but they don't stop it in Tennessee, eventually it's going to make its way here again. It's going to find us. The same way around the world. So we have to kind of keep that in mind. And today I just wanted to talk about what's going on with Georgia. And Governor Kemp made an announcement a couple days ago, and I just had to take a day off to process it. But the ramifications for all this, disease and this virus are very personal and health-wise, but then it's also financial. And I get it. And how we do that wisely to get back to creating a new normal, that's kind of the challenge. But one thing I do know is you and I both have access to all the data that's going on. So you don't have to listen to your crazy neighbor who tells you what the facts are, or to the TV if you don't want. I mean, right now it's posted online. So Georgia has it. You can find that information right here. And every state is doing that. So I've been looking at this stuff. I just started writing down the reports for every day to see how it was going. So one of the things is like this. There's some really good data out there. That shows the number of states that the number of counties in Georgia that have been impacted by the virus, that have it. And it's pretty much everybody, right? Some have very little or very low case impact. Others have high. But the important thing is that it is all around us. Now, one of the things everybody's been talking about is flattening the curve, flatten the curve. It makes sense in your mind. You go, oh yeah, I don't want it to keep going up. Now, it depends on which curve you're talking about or which data is being caught, right? So it's the cumulative deaths, the cumulative infections that we have. Because that means each day we're adding, there's 12 more, there's 14 more. That means it's going to keep going up. But if today the number of deaths stayed at 9, just like yesterday and the day before, then it flattens out. If we have the infections being at 800 and just staying there, then we've pretty much done it. There's been no new infections. So that's what the flattening the curve means. So on some of this, you can see, like this was February to April, you can see that these are the deaths by day, the cumulative deaths by day. So it's still going up, right? But then you come here and you look at kind of the rolling averages. And you can see the numbers starting to go down. It's looking like it's going down, which is awesome. And that's got to be in part because of the stay at home and the social distancing that we put in place. Now here are the number of cases, right? So it's going up. But then when you look at the rolling data, it is starting to tip down. So those are great facts, but it's just the beginning, right? It hasn't dropped to zero. And granted, it may never drop to zero, but until we have a vaccine, that really matters because it stirs up again and it reaches new communities who haven't been touched by it. So my concern is that the federal plan for opening up America has 3 phases, right? But let's just talk about the first one. So the first one says you have to have a downward trajectory of cases over a 14-day period. Even this rolling data that we have, it's not 14 days. We're getting close, I guess. They're kind of pushing it out there. But then there was also from the feds, it says you have to have a downward trajectory of positive tests compared to overall tests. And in this data that they show on the state site, that is not happening. If anything, the number of positive tests to overall tests has gone up a little bit each day. It's right around 3.5. It's gone anywhere from 3 to 4%. And it is not dropping. So that kind of concerns me. The other thing, you have to have safe screening and testing sites, according to the feds. And right now, Georgia does not have that, as far as I know. Now, in Governor Kemp's mention, the Augusta Health Network, they're going to help with screening and testing, they said. But if you go online, and you can go online and find this out, and you can see what they're doing, which is really amazing, is they are creating a telehealth platform so that every Georgian can call in on their phone. They can have a video teleconference, either through that or through their computer, I guess, with a doctor. So if you don't feel well, you can talk to a doctor and they can go, oh, yeah, that's meeting some of the criteria, but that's not a real test, right? Now, they don't say what the next step is, but my guess is they would say, go to your emergency room and get tested. So that's the plan we have in place. We're not driving in stations. We don't have those all around the state, or, pop-up shops that just test this. That is not in place now. And so for us to loosen the regulations seems kind of odd and against what the feds say that we need to have in place in order to go forward. And those are just a couple of the things, but the most important things to me. So with this new executive order, this comes while we have a state of emergency until mid-May. And we are on official stay-at-home lockdown until April 30th at midnight. So obviously we couldn't just hang out or just wait another week for that. We had to jump in early. I don't understand that. But needless to say, the good thing about the executive order, for a lot of people, I'm sure, is that all physicians, dental services, physical therapists can operate as normal according to under the CDC guidelines. And they've got to be comfortable too doing that. But if you need work done, if you need physical health things taken care of, hopefully your professional will be able to help you. The fact that right now you can get, on Friday, eyebrow threading, body waxing, gyms, bowling alleys, body art studios, tattoo studios, nail salons, massage therapists, and hair salons will be open on Friday. And I know these are some of the small businesses that actually are the economic engine of this country. But I think we have to be honest about the real importance of those, especially if we are still at stay at home till the end of the month. Churches, they can open their doors for services, full-on services, as long as you have distancing guidelines in place. If you have to go out into a group setting, just decide that on your own, you're going to make sure that you follow these guidelines. On Monday, theaters, private social clubs, I'm guessing like golf clubs and things like that, and dine-in restaurants will be open. Okay? This has been done around the world in different places, right? You can go and sit 6 feet apart from somebody in a theater or at a restaurant or at a club, and you can survive. Is it required right now? I don't know. I don't think people are going to be comfortable with going back to it. A lot of people aren't going to open. Theaters, movie theaters, definitely, you're not going to see those just turn around and open back up. That's something that you can think about, and you can find that all those links online. I'll try to put something right here about the health system at least, so you can see. They've got some good advice. And this Georgia plan that the governor's doing, unlike many states, it may help some businesses, but it definitely doesn't reflect us having beat the virus. None of the data that I'm seeing, and I'm just a guy looking at the numbers, I'm sure there are pros that maybe have a better explanation that I'm not seeing, but we have not shown a great decrease and a solid, like we've got this under control in the numbers. starving this virus is the only thing that has proven to work. In countries where it has worked so far, that's what it has been. They managed it through quarantine and testing. They tested to make sure that the virus was not around anymore, that it was pretty much gone. And if we can't do that physical testing, I'm not saying talk to a doctor who says, sounds like you've got it, but an actual swab or anything else, that's going to be a real hard hurdle for us to get over to move forward. And know that everybody is watching the state of Georgia right now. And they are saying, is this a fool's errand that they are going down here and they're going to turn around sicker than before? I pray it isn't, and they're wrong. But the real problem with this is an invisible challenge. And this virus can hurt everyone. It can get kids. It can get healthy athletes. It can get older folks. Sometimes you just might have a genetic structure that is very welcoming to this virus. So understand that it's not about age or gender or sex or color or anything. It's just a virus. And the real challenge here is that others have compromised immune systems, right? Do you know all of your neighbors and friends and coworkers who have compromised immune systems? I mean, for me personally, I don't introduce myself and say, hey, I'm Boyd, I've got diabetes or rheumatoid arthritis or I've got MS. A lot of times we don't share that with people openly. But those are the people that we can really hurt through this. Because I might just have it and don't know it, but if I spread it to someone, like a neighbor I do know who has a compromised immune system, now I've put their life in danger. So that's why it's so important, this distancing, the washing the hands, but also building our testing up. We've got to demand that somehow our national government can create testing or find a way to spread it throughout the states so that we can all know more. We just got to be smart. I mean, governments aren't going to stop this. They can't do it alone. It's really citizens that'll make all the difference. And through our actions, it'll get better or it'll get worse. So anyway, that was just what I had to say. I just wanted to share because I really feel if everybody sees the data and they see the numbers, by their county or by, where they live, it'll give them a better sense of what's going on and how deep this thing really goes. So stay healthy and pay attention to the data and help others whenever you can.